Welcome one more time to our channel. In this video we'll cover the VA disability for benign prostatic hyperplasia, or BPH. In this presentation, we'll cover everything you need to know about this condition and how veterans can successfully claim disability benefits for it. So stay tuned, since we are ready to start. Do you have to go to the bathroom many times a day no matter where you are? Maybe you are suffering from benign prostatic hyperplasia. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate gland, a walnut-sized organ located below the bladder in men. This condition can cause various urinary symptoms and discomfort like, for example, difficulty starting urination, weak urine flow, hesitancy, dribbling after urination, frequent urination, especially at night, and urgent need to urinate. The exact cause of BPH is unknown, but it is thought to be related to changes in hormone levels as men age. Other risk factors for BPH include family history of BPH, obesity, diabetes, heart disease, and high blood pressure. Service connection for BPH, like with other conditions, requires that you have a current diagnosis, an in-service event, injury, or illness, and a link or nexus with your military service. The VA examiner will use the Male Reproductive Organ Conditions DBQ to document everything related to your BPH in terms of medical history, symptoms, physical exam, and the impact in your daily life. This information will be used by the VA rater to make a decision in your case. Let's go over the VA rating for BPH. The VA rates BPH under the code 7527. It instructs the rater to assign a rating based on the severity of the voiding dysfunction or urinary tract infection, whichever is predominant or the worse. So, if you predominantly suffer from voiding dysfunction, your BPH rating can go from 20 to 60%, depending on the times a day that you have to change your absorbent materials. For example, changing your absorbent materials less than twice a day will be assigned a rating of 20%. But if you have to change 2 to 4 times a day, the VA will assign a 40%. And if you have to change more than 4 times a day, then your rating will be 60%. But, if you predominantly suffer from urinary tract infections, then the VA rating can go from 10 to 30%. For example, a 10% is assigned for recurrent symptomatic infection, but no need for hospitalization, only a need for suppressive drug therapy for less than 6 months. A 10% is also assigned in the case of recurrent symptomatic infections that require 1 or 2 hospitalizations in a year or the need of suppressive drug therapy for 6 months or longer. And a 30% is assigned for recurrent symptomatic infection requiring drainage by stent or nephrostomy tube, or requiring greater than 2 hospitalizations per year, or requiring continuous intensive management. But if your condition has progressed to a poor renal function, then it will be rated as renal dysfunction. When your condition has progressed to renal dysfunction, the VA will assign a rating that goes from 0 to 100%. This rating takes into consideration several laboratory findings that determine the severity of the kidney damage. Here are some tips for veterans claiming BPH. Gather all your medical records, including records from your military service and any private doctors you have seen. Be prepared to describe your symptoms in detail. Get a Nexus Letter to help you establish the link between your BPH and military service. And if you have any questions about your claim, contact a Veterans Service Officer or VSO or a VA-accredited attorney. Understanding the process of claiming VA disability for BPH is crucial for veterans dealing with this condition. Don't give up, and make sure to get the support and documentation you need. Thank you for watching, and we hope this video helps you navigate the VA disability claim process for BPH.